Hi, this is Dr. Peter Grinspoon. Thank you so much for listening to my YouTube channel. Today we're going to talk about my brother Danny, his tragic fight with childhood leukemia, and the way in which that helped educate my family and essentially the world about the use of medical cannabis in chemotherapy-induced nausea and vomiting, and the ways in which it helped pave the path for medical cannabis legalization. Before we start, please press the button on the lower right of your screen where you can subscribe to my YouTube channel for free. And there's lots of great content about different drugs of use, different drugs of misuse, different medical issues. Please subscribe. Today we're talking about my brother Danny. My brother Danny died when I was 8 years old. It was very traumatic for me and my family. What he died from was acute lymphocytic leukemia, a type of leukemia that is common, but today has about a 99% cure rate. The reason it has such a cure rate today is because of all the wonderful scientific studies we've done over the decades, starting with my brother Danny, and now they know which chemotherapy agents actually work and can keep people alive. But unfortunately, my brother Danny was not that lucky. He had leukemia starting when I was age 1. He was treated at Harvard Medical School. He was treated at the Dana-Farber Cancer Institute. And the biggest challenge for Danny was tolerating the nausea and vomiting that came from the chemotherapy. The chemotherapeutic agents kill the cancer cells, but they also kill a lot of your own cells and make you so sick. And then, according to my parents, Danny was originally very brave and sort of steadfast when his chemotherapy regimens started. He'd go in, he'd have a good attitude, and he'd get his chemotherapy. With each round of chemotherapy, he would get sicker and sicker, and it got to the point where he was really anxious, really resisting, raising a fuss, really giving my parents a hard time about even taking him into the Dana-Farber Cancer Institute because he was so sick. After the chemotherapy treatments, he'd be lying in his bed, throwing up into a bucket in a dark room. It was really awful. And this is not unique to my brother Danny. I mean, millions of people have cancer, millions of people suffer from chemotherapy, and the traditional pharmaceuticals that we have to treat chemotherapy-induced nausea and vomiting are not particularly effective. The prochlorperazine, the ondansetron, they help, but as we'll talk about in a little while, they're not as effective at all as medical cannabis. Now, my dad is an expert, he passed away a few years ago, very famous expert on medical marijuana. He wrote the groundbreaking book in 1971, Marijuana Reconsidered. Eventually, he came to write another groundbreaking book called Marijuana, the Forbidden Medicine in 1993, which literally educated so many doctors and patients about cannabis and paved the way for the first state in 1996, California, to legalize medical marijuana. Fast forward to 2026, 38 to 40 states have legalized medical marijuana, and this is all in large part, not entirely, but in large part due to my dad. My dad was a respectable doctor at Harvard Medical School. At that time, the medical community was completely against any use of cannabis because, they were just caught up in the drug war. They were propagandized. The doctors were brainwashed. And as I talk about a lot in my recent book, Seeing Through the Smoke, the medical profession really failed patients when it came to medical marijuana. So my dad was nervous about using medical marijuana for Danny. This is in the early 1970s. It was right when Richard Nixon was starting his war on drugs. It was illegal. My dad could have lost his job as a doctor. My mom and dad could have been arrested for buying cannabis. So my dad originally said, no, even though this is really interesting, I can't stand watching Danny suffer. We can't break the law and do anything illegal. So my mom, believe it or not, she's still alive at 95. She's so mild-mannered and sort of law-abiding. She couldn't take watching Danny suffer. So she actually went to Wellesley High School, where we grew up in Wellesley, Mass, and asked a friend of Danny's named Mark, can you get me some cannabis to help Danny with the chemotherapy so he can go through the chemotherapy and not suffer as much? Now, Danny's friend Mark, of course, was like, no, Mrs. Grinspoon, I wouldn't know anything about where to get cannabis. But at the end of the day, Mark's love and friendship for Danny sort of overcame any fear he had of getting in trouble for providing a parent with marijuana in the early 1970s. And Danny said to my mom, guess what? I have some grass and a pipe in my pocket. So the next time they went to chemotherapy, Danny tolerated it really well. My dad didn't even know at first that he was on medical marijuana. They didn't tell my dad. It was just my mom and my brother Danny. It's kind of ironic because my dad was a big cannabis specialist, but he was not part of this. Danny tolerated the chemotherapy so well, he even asked for a submarine sandwich on the way home. He had no nausea and no vomiting. Now keep in mind, before the cannabis, he would be lying alone in his room, throwing up into a bucket, retching for up to 8 hours. He was losing weight. He was miserable. He was anxious. He had this anticipatory anxiety about the chemotherapy. Again, this is like millions of cancer patients, what they're going through with chemotherapy today. After the cannabis, Danny, again, could eat. He stabilized his weight. And, instead of lying alone in his room, throwing up and being miserable and alone and sick and really anxious about the chemotherapy, he'd get back to like seeing friends, strumming on his Fender Stratocaster. He was a guitar player. He loved playing guitar. And most importantly to me and my twin brother, coming down and playing with his little twin brothers. It was just like absolutely astonishing. Now, Danny eventually succumbed and he was 16, but the cannabis made such a drastic change in the quality of life in the last year and a half of his life. He maintained his weight and he was able to participate in activities of daily living. It just, his quality of life was so vastly improved. Now, the cannabis doesn't cure the cancer, as some, unfortunately, proponents of cannabis say, but it actually is one of the most effective medications for the chemotherapy-induced nausea vomiting. This, of course, is one of many indications for medical cannabis. I've been treating people for 25 years for pain, for anxiety, for insomnia, colitis, spasticity, and multiple sclerosis. Tons of indications, which I talk about many times in other videos. But my brother Danny, his healing from medical cannabis, the drastic effect it had on his quality of life, the ability it gave him during chemotherapy to face his disease bravely and to live with dignity and comfort, it really had such a profound effect with me as a little kid. I learned to associate the kind of the very sweet smell of marijuana smoke with healing and feeling better, as opposed to all the nonsense they were providing us in middle school, middle high school, grade school, the DARE program about like how bad cannabis is. It has no medical use. It makes people addicted to heroin. It saps your motivation. It lowers your IQ. All the silly nonsense about marijuana that I've debunked in so much writing and in so many videos. I actually knew and was insulated from all the nonsense they teach you about in middle school, in high school, and then in medical school. What they teach doctors is terrible about medical cannabis. It's getting a little bit better, but it's still, they don't really fully explain to doctors like the endocannabinoid system, the neurotransmitter system, how which cannabis works and which does so many other things in our body. And they just sort of don't explain the fact that most people who use medical cannabis actually do really well on it. There are certainly harms with any drug or medication. Some people shouldn't use cannabis. I talked about that in other places, but generally speaking, and using my brother as an example, if someone has chemotherapy-induced nausea and vomiting, most oncologists actually would agree cannabis is a really, really important first step in terms of alleviating symptoms. I know that today's video is a little bit more personal, but I can't even describe how impactful it is to see the lessening of suffering in a loved one. And it really impressed upon me, again, not a cure-all, not a drug for everybody, but it really impressed upon me the healing effects of medical cannabis. This is Dr. Peter Grinspoon. Thank you for watching my YouTube channel.